Welcome, everybody. We're going to get started in a couple minutes here, and hopefully, if you're wondering if you're in the right webinar, this is about using technology in enhancing social service delivery. So, how do we get to client outcomes, enhance team collaboration, and reduce the reporting admin burden, and offered by Help Seeker Technologies. We'll tell you more about that when everybody's logged in. But if you're here, you're right on time, which is not exactly usual for us in the social sector. We're doing that one last thing. So we'll make sure we give people another minute or two to wrap up their other meetings and commitments before we get fully started. Meantime, though, if you have access to the chat, would love to see, let's see in the chat who you are, what organization you're from, and I'll say, I'm Alina Turner, I am the CEO. And if you know the treaty territory, we always love to hear what community and First Nations community you're from. So yeah, throw it in the chat and we'll say hello. We'll do some shout outs while folks join in the meantime. And let us know if the chat's not working. Sometimes it's kind of annoying and it doesn't properly do it. But let's see. Come on, do it. I wanna do shout outs. Somebody type it in. Let's see. At least to know it works. Or maybe somebody from my team try to do it. There we go. Oh, good. Yay, it's working. It was just like on delay. Cool. Shirley Belmorat from Métis community of Beauval. Where's that? Shirley, I've not heard of Beauval. Sounds really cool. Sounds very like legit Métis. Welcome, Tracy Saint-Amant from Winnipeg Treaty 1. Red River Métis, amazing. Maureen Algabo from Home Care WRHA. So Maureen, like, what's that? I wanna, you'll have to spell that out for me. Waterloo Regional Hospital. Did I guess that? Angela, contract work in Indigenous communities, Winnipeg, Treaty 1, Cree myself, amazing. Yes, Amanda is asking if we're recording and we'll be sending this out. You betcha. You can then ignore me for the rest of the time, because then you can put me on speed and go faster. Just kidding. I do that sometimes though. Maurice Lozier, social worker, social development, New Brunswick. Awesome. Nice. Welcome. Awesome. We're up to 50 folks. We'll give another minute. We'll do some more shout outs. Okay, let's see who else. Maureen, Winnipeg Regional. Hey, I was close. I mean, not really, but I got some parts right. Maureen is from Winnipeg Regional Health Authority, WRHA. Cool. Saida from Ontario. Welcome, Saida. Yeah, if y'all know the territory, the First Nations territory, even the Indigenous name, it's always really cool. Never get to learn about all of that in your usual webinar, so it's really cool. Calgary's Indigenous name here is Mohkinstsis. Byron, Cree Nation, Child and Family Caring Agency, Treaty 4, welcome. Esther from GOA, Edmonton, Alberta. Oh, thank you for sharing. She's on a bit of a break. Beatrice from Turtle Island, isn't that cool? Yeah, absolutely. Martin from Heart Feelings, Mental Health, Toronto, Treaty 13. Diana Delgado, Community Services Leader from Territory of Kwetlan people in BC. Very cool. Oh my goodness. Now I can't keep up. Now y'all are too fast. Look at that. Tanya Funk. I love your last name. Treaty 6, and Fatuma from Winnipeg School Division. Awesome. Micmacs, Sheila from the Micmac territory. Awesome. You guys, please feel free to keep adding. Just this is as much as about y'all getting to know each other in the community as it is about me, but Just in the interest of time, I will get the party started, as they say. So welcome, and thank you very, very much for joining us today. I'm excited to talk to you about data, because that's all I do at Help Seeker is live and breathe technology. But it's really about how technology can help all of you in the work that you do, because that's the whole point of it. How do we reduce administrative burdens? How do we improve client outcomes? How do we enhance team collaboration in your work? And so with that being said, absolutely, we will be recording this, and we will definitely be sending you the slides and any resources that might come up in the discussion as well. So the reality of frontline work, as you all know, is that you're expected sometimes to do it all, delivering that best care. But sometimes the reality is that you can't do it all. And so that's where some of this data-driven technology can come in to support you in that sense. We know the complexity of caseloads, tight resources, growing client needs. I don't think we've seen the complexity and the growth as, I mean, I've been in this for 20, 30 years. I used to be a client, then I became an outreach worker, then I became a funder, then I became a researcher, and then I became a tech company that helps organizations in this space. So I've seen it all, but I don't think I've seen the complexity and the caseloads what they are today. And I think we work in about 300 organizations, and that's the theme, right? It's very, very common to hear stories about people feeling overwhelmed by the sheer volume of tasks, from client care to paperwork to compliance to reporting. And the sad part of it is that then the diversion from meaningful client relationship building and rapport is unfortunately diverted, and that endless paperwork or bureaucracy becomes, you know, like, this is not why I went to get a social work degree, or this is not why I'm in this work. So the more time spent on admin tasks, the less time you have for that meaningful work. And the question is, can we address that imbalance today? So by the end of the session, we want to give you some actionable ideas on how tech can help you focus more on clients and less on that bureaucratic stuff. That's important, and that's awesome. But there's good new tools now that can help you on it. We'll show you some of the ones that we have, but we'll also give you some tips on some other ideas of where you can really streamline. And the whole point here is, again, how do we increase client outcomes? How do we reduce the admin burden? How do we streamline case documentation and ensure that compliance is there? Because that is absolutely important. A lot of the case notes that you write, sometimes they do end up in court, right? So we do recognize that there's a legal aspect to compliance that is absolutely essential as well. And then, of course, you know, can we help actually enhance the game, right? How can we actually improve case management because we have some of these tools that prompt us or remind us about good practice as well? So the question becomes focusing about what you do best, which is that meaningful care, and focusing on what you do best, that meaningful client interaction. And while software can handle the admin burden, let work behind the scenes. The idea is that, you know, the tech can now help you with the admin tasks, like filling out forms, like entering data, like generating reports, so that time that you used to spend doing that can be, what would you do with that time, right? What else could you be doing? Including just like not crying in a corner because you're so overwhelmed as well. It doesn't have to be anything super revolutionary. So that's the value of tech and case management software in particular. We're going to focus on that one today, because that one's specifically made for social work to automate repetitive tasks, things like assessments, things like follow-ups, things like reminders, and to save you that hours every day. And I was looking up the most recent analysis on this is when the right case management software gets implemented in social work organizations, it saves an average of about 6 hours a week, which cool, which is good time to do something much more meaningful. So let's hear it from you. If anybody has done a Slido before, congratulations. For those of you that haven't, though, I will walk you through. So you can type in, or you can take a picture of the QR code, and it'll pop up. A link will pop up. And so when that link pops up, you're going to see the question, and you're going to just basically type it in. So it's audience participation, because that's how we do. And then I make sure that we are actually learning from each other, not just from me talking at you. So I'll do it myself, just so I can make sure it works. Although my team has reassured me that it does. So yeah, you can take this is a meeting where you can actually use your phone, take a picture of that QR code and type in your answer. What's your biggest challenge when balancing admin work and client care? So time, we're seeing not enough time, too much time documenting, time and support, complexity of the situation, or requirements, workload, time, reporting. Oh my goodness. Getting it all done, time, finding time. Okay. We got five more people talking, so we'll make sure, let's hear from you. There's 67 of you in the room, so I want to definitely give this some space to breathe. Yeah, tech that works. Yeah, the biggest challenge, tech that works. Yeah, that's annoying too, right? When you've been promised that the magic is going to happen and it doesn't happen. Consistency of reporting across the team. We've definitely heard that before, when there isn't very good, business thinking around, like, why are we recording this? Time and paperwork, organizing paperwork. And so it's interesting because we have one of our, well, people still type, please keep going. This is, we'll stay on this for another couple of seconds, but I'll tell you a anecdote. One of our organizations that we work with is a friendship society, and when we were implementing the software with them, said, well, we're transitioning, right? We're transitioning from the current record system into the software. And I said, well, where are your records? And so the manager, outreach manager, is like, no, like in this folder, in the desk. I just keep putting things in the desk. So when you say paperwork, I know what you mean. It's an actual desk that is filled with paper that has never been analyzed. It's there. Nobody can say otherwise. It's locked. It's FOIP compliant or FOI compliant, depending on where you're coming from. But it really hasn't seen the light of technology, and unfortunately. So I hear you. Yeah, so let's see what else y'all said here. Different time zones, okay. The requirements of confidentiality with documentation and important tracking points for ongoing relationship, team follow through on reporting, time management, time and prioritization, privacy, time, tech that works, paperwork. Look at this, interesting. Okay, what's this? Staying up to date on clinical notes. Yeah, absolutely. So I see 3 more folks typing, and I don't want to cut y'all off. So we'll give it 30 more seconds. Okay, so admin work that's not necessary and is deemed as needed by an organization. Yeah, so somebody made it up that that you should be doing it, and you're like, I don't get why we're doing this. Yeah, documenting repeat phone calls and confidentiality, overworked and underpaid. Yeah, no doubt. Okay, I'll leave it at that, because that's 26 of you that participated in that. So that's awesome. And there's going to be more of these as well. So here's another one for you. In one word, what would help you spend more time with clients? So let's see what we think on this one. If there was one word. Thoughts on this? Flipping the script, I guess. Support. Okay. Guessing support. Tech. Yeah. Sure. Efficiency. Yeah. Yeah, getting rid of the unnecessary stuff, more resources, integrity. Wow, interesting. More staff, tech, automated reporting. Oh yeah, yeah. I can help you with the tech. Things like, indirectly, it does impact resources, of course, and efficiency. More staff, smaller caseloads. Yep. Proper job evaluation and workload balance. Interesting. Voice to write. I use my voice to write all day long, y'all. So absolutely. Text to speech. Absolutely. Yeah. Yeah, that definitely helps. Definitely helps. Yeah, we use those all the time as well. Can write entire reports just using voice to text and then text with AI. Absolutely. Faster internet. Yeah, yeah. You know what? That's fair. That's fair. Oops, sorry, I cut you all off there. Fiat compliant tech to make notes easier. Yeah, absolutely. Yeah, not just you can't just and we get this another anecdote. We get this all the time where we'll present like the software and they're like, oh, that's great. It's just like Google Forms. It's so easy to use. And then we say, so wait, are you using Google Forms for case notes? And yeah, it's great. It's great. And we're like, okay, like, Google is a US company and it's not compliant. It's not meant for this. So I can definitely hear you on that too. Yeah, you got to make sure you're using the right tech, not just any tech. Okay, we'll let this one breathe for a couple more seconds and then we'll go on to the next part. Automation. Cool. Like you're setting me up for the rest of my speech here. So we're good. We're on the same page. All right. I'll move us along. But yeah, absolutely. We'll be sharing these results with all of you. Thank you. So wanted to share just a couple of some quick wins to save time and reduce admin work, and some of them I've already mentioned. But for sure, some of the low-hanging fruit. So when we say save 6 hours of time, the kinds of things that you can do right away are things like recurring reminders. So setting reminders for tasks like assessments and follow-ups can ensure nothing falls through those cracks. And it's amazing how case management standards tell us, quite well that there's certain standards you need to meet in terms of intake and assessments and follow-up assessments and entry after every case meeting. You're supposed to do your notes right away, but if something happens and you forget. But these setting reminders for these either recurring tasks or tasks that always happen after an event, a particular type of event, that really, we find that's a low-hanging fruit that really saves on time and enhances the quality of the notes, because they tend to be much better done. The data is way better because it's fresh, it's off the top of your head, and then you're not doing the reverse, like, oh, what was I doing 2 weeks ago type of thing. So that helps folks stay on top of tasks without constantly thinking about what's next. And it reduces the stress because the tech is reminding you, right? You don't have to keep it all in your head. That's a huge one. So that recurring reminder concept, if you're not doing it, highly recommend. The next one is digital templates. So templates that, you're always, if you find that you're always doing a type of report and you're seeing patterns of what those reports are, even, you might be doing it on your own. Ideally, you're doing it as a team, because if you're doing it by yourself and you're not letting your teammates in on it, you're not going to get the most benefit out of it. But if there's reports that you're constantly having to do, creating digital versions of them is, again, a really nice way to speed up time. So you can pre-fill these digital reports so that the basics are already done for you. And I would also say, because somebody said voice to text, there's a really good trick one of my teammates taught me. If you have a Windows computer, I can tell you right now, and I know most of us do. I don't know how it is on Mac, but I'm sure you can check it up. But you can essentially click the Windows icon at the bottom of your keyboard and H, the letter H, and automatically you'll hear a beep like this. I don't know if you heard it, but there it is. And so when that beep happens, that means like the voice to text is activated right off your computer. So you can, and you just talk your notes out. And then just right off the bat, if that's the only thing you do, you have your digital template and you talk into the digital template, put it away. When it comes, that is huge amount of time saving, and you'd be surprised what you can do with that after, because again, it's fresh. The next one I'll talk about is shared task lists. So that concept of tasks that you have to do per client. Every client has certain things that need to happen on a consistent basis. But there's probably kind of general things that as a team, you all agree should be done. So a tracker that ensures that team alignment is really, really nice ways to A, get alignment, but B, save time, because you're not having to reinvent, like, okay, what's the next step with this guy? What's the next step on employment? What's the next step on income assistance forms? So that also, by mapping it out together, sitting down, brainstorming what those tasks are in these journeys, right? And we always talk about journey maps and make it sound like it's so complex and you need to hire a billion consultants. No, just make the list on what should happen next. Put that list somewhere digital so that everybody knows where it is. And then just duplicate that list. So then you're not having to reinvent it. You can take the task and kind of modify it a little bit or assign it to somebody else, but you're not having to reinvent it. And then batch tasks. This is another idea. Batch tasks in terms of blocks of time. So dedicating specific blocks of time to things like emails or admin tasks improves focus and prevents those interruptions throughout the day. So easy way to do it. And if you saw my calendar, you'd see it all the time, that there's chunks of time that are called admin, or chunks of time that are called reporting, chunks of times that are called tickets, like, because we have all of these things as well. So by working on tasks that are similar, your brain kind of gets the rhythm of it, and you actually become way more productive on that too. Again, easier said than done, don't get me wrong, I know how it is, but blocking that time is huge for, and then you batch and push. We always say, like, ship it, right? Get it done. Block time for client work though. So emphasizing the importance of that scheduled, uninterrupted time for client interaction to get those better outcomes and being fully present is huge. And if you look at your calendar and you look at the blocks of time, like how much time, like truly is for that one-on-one meaningful interaction versus the tasks that have to do with the client. So, don't mistake doing admin work for client A is the same thing as doing client work, right? The client work is that where the magic happens, and that time, that relationship, that stuff's sacred, right? And it should be a certain amount of your week on a consistent basis. And when things, and everybody has their own kind of vibe in terms of what that ratio is of, bureaucratic work or reporting work. You're doing client work, but is it client interaction work, right? Because if that's not happening, and if your majority of your time is doing work about the client versus work with the client, then you gotta have some tough conversations with somebody in charge, hopefully. So that's the whole idea here, is that we ensure no individual falls through the cracks because of the busyness of the work. So think of it as having an extra pair of eyes with the technology that is available nowadays. It's having the other pair of eyes so that those aspects don't take over the stuff that's important. So the other piece around case management software is that it helps on tracking progress, making those informed decisions about the client, and it helps you actually have the data to drive decisions and adjust your services in a much more real-time basis based on actual client progress. So assuming you're doing you're doing all this stuff, assuming you're using case management software and assuming you're putting in the notes, you're putting in those interactions in. Every time you add something to it, it becomes a data point. And if you have the right software, and I'll show you ours, there's lots of other ones. I'm not saying that there aren't, but if that happens, then you're getting that real-time feedback so that you can actually start intervening sooner if challenges arise, because you're seeing the patterns way quicker as well. And of course, then you're theoretically not going to be in the same kind of reactive boat. We always say, like, we're a reactive industry because we're always in crisis mode because our clients are always in crisis mode. But that's not what we should be, right? We should be the proactive ones so that we get our clients out of crisis, right? But we can't wait for the client to get us out of crisis. We're the ones that have to do something different to get ahead, to be proactive. So data-driven tools have been one of the ways that you can get upstream, right? Because you can start to, like, you're starting to see the patterns, and you intuitively you do that, right? So somebody said they work in a hospital, and like, the full moon happens, when seasons change, when certain times of the week happen, those things intuitively, but there's probably things you don't know as well that are going to be surprising when you actually look at the data as a team or as yourself in your own case load analysis. So we'll like I said, we'll show you some examples of what we've implemented and how that can help you think through that. So let's say, and this is just an example, this is fake data, as you can obviously tell with the Donald Ducks, et cetera. But if a client's struggling in a particular area, software can flag this early. So you can actually, create literal flags that will kind of come out in as an automated ding to say, hey, there's something going on here, and it can flag it for you. Where otherwise, if that file is just sitting literally in a folder in your cupboard, how's that piece of paper gonna wake up one morning and like knock on your door and be like, hey, this is actually a problem, especially when multiple caseworkers are on the same family, for instance. Like you don't see the connections, but with software you actually can. So because somebody might actually put in something that they don't even think is a early warning sign, but because it adds on top of a bigger record, it now gets flagged, and it gets flagged up so that situation doesn't escalate in the same way. Personalized care is obviously always the gold standard, and the data allows you to see where these interventions are needed and adapt those services for each client in a little bit more proactive way, and definitely in a data-driven way. So with that being said, the software's ability has to be able to produce that accurate, detailed report that doesn't just reduce stress, but also ensures that you're prepared for those funder reviews, your compliance audits, again, I'm sure I don't need to tell you how many checks and balances the work requires, but staying compliant reduces stress too. So if you build in these processes, the technology can help you stay ahead of that, because you're building in those funder and regulatory requirements into your processes as well. And that software can simplify this by things like automatically generating reports or tracking data points required for audits and reviews. That's a huge, huge value add. So when you're able to just, instead of scrambling to gather the information for, funder X is wanting today to know how many clients you have. And that always created, for me at least, it always created this panic of like, okay, how are we gonna, like, that's, oh shit, we don't even collect that. Okay, let's make it up. Sometimes we made it up, I'll be honest. But at every funding period, something, there's predictable things that you can actually build in and you can automatically generate, but how can you also have things at your fingertips? So when those one-off requests come in from the CEO or from a new philanthropist that wants to donate money for this one particular type of client, then you can actually like go into the data yourself and pull that out, right? And a lot of the times when one of the organizations we're working with, for instance, they had a software where they couldn't see the data. They would put in data, but they couldn't get data back out. They had to like talk to the developers, and once in a while they would, or another organization that puts data in, but only their funder can access it. Well, what's the point, right? Like I get the point from that perspective, but if you're not using the data yourself, if you're not building the capacity of the team, then you're missing the whole, at least 90% of the value. So if you do it right, it reduces the time spent on data collection and reporting, and it frees up, not just time, but it frees up your mental capacity for client work. And you're bringing a different angle to the client work too, because now you've got this data point in your head, you've got this insight on how time is being spent, or what kind of trends you're seeing. Or we're seeing, and I had a really cool conversation. If anybody knows Alpha Health in Calgary, they do harm reduction work, and it's a detox emergency shelter, one of our biggest ones here in Calgary. And they had never looked at the data from the usage of substances perspective over time, and the age and demographics of their clients. And it was, so we did that deep dive with the leadership team, and there was about 20 managers. It's a huge organization here. It's about 300 staff, but they had never looked at it together. And so they saw the change from huffing, for instance, which was really, really popular as about 10 years ago. They saw that change into meth. They saw the change into fentanyl. But alcohol still number one. But then they also noticed that they're not collecting things on things like xylazine, for instance, or that their staff don't even know the names of the new substances because they're changing so quickly. So again, it's not just fun and games, but it matters, right? The types of substances that are coming through your buildings matter. And again, the conversation was, well, how would you do casework differently? What does that mean for your shelter operations? The fact that it's now fentanyl matters way more compared to 20 years ago when you started out and it was alcohol. How have you changed operations? Even things like ethnicities in the building, right? And because there's associations and organized elements within the populations, it changes the mood, and it changes the level of risk and the level of violence depending on who's in the shelter at that time. So there's real consequences to this data, and if you're not collecting it, and if it's not their real time, you're missing it. You're missing these opportunities, and they have real consequence. I need to tell you that. So ultimately, better collaboration means better care, better outcomes, breaks down those silos, and improves communication. That's kind of the big play here is in many social service settings, teams work in these silos. There's limited communication between staff members, departments, or agencies even. And so having an organized platform that lets you see that client data with, of course, client permission, share notes, tag each other, right? Being able to work on the same client's file without having to move the actual file from, in terms of paper, that saves a huge amount of time and improves those transitions between services and referrals, makes those way more seamless. Lots of organizations are starting to implement things across organizations too, especially in networks that are always referring to each other. Those are really kind of low-hanging fruit. There's kind of clusters in community where you can see like these three always work together on this type of client. You can create a network that enables data sharing with client permission to do that. And again, Winnipeg's a really great example where two major organizations that are serving complex needs are doing that, because they're like, most of our clients go back and forth, so it makes sense for us to integrate. What's some of the examples? And again, you're looking at some actual software examples of how this works, but an example here is a social worker that can see notes from across services without sending multiple emails. So referrals between services can be easily tracked. to have those smooth transitions for the client. And this centralized approach gives you that unified care plan and reduces the gaps, overlaps, and even like drop balls between organizations that are like, well, yeah, I thought you were doing that. Oh, well, I thought you were doing that. Well, it's all here. So we're all on the same page now. We know if somebody dropped the ball, it's right there. And if alternatively, if we crushed it, we can see the results and why that worked. Right. So the other piece too is automating the routine, and we talked a little bit about that. You're freeing up your mental load for the things that matter, working along with clients and guiding them towards that success. And oftentimes we juggle way too many tasks at once. Easy for things to slip through the cracks. So how do we automate things? And I mentioned that before, but how does that work? So one thing, and again, you're looking at it here, you can set up automated reminders for client check-ins. You can set up reminders for follow-up assessments. So you never have to rely on your own, sadly, on your own memory or manual tracking. One of my favorite things that we did with one implementation is we created an automated kind of every time the file was moved with the client's request and permission, there was also an email that went to the client as well to confirm that this is where they're at. So the client themselves can be part of their process, not just us. So using that data to show the tangible impacts, I mentioned quite a bit about this. We love data, so I think that's part of why we created this part of our product lines, is because a lot of the data that we wanted to have, organizations couldn't give us. And so the reason for collecting the data is that you can get the insights as well, and you can move into systems change, because you can roll up things that are happening at the individual level. You can roll it up at the org level, and you can roll it up to say something about systems change as well. If we don't track it, then we're just kind of using anecdote. An anecdote is great, but it does not resonate the same way that a nice data set that's well analyzed does. So the reports that you can generate now for securing funding, providing that efficacy of your work, that proof, is huge for applications, for grant reports, for advocacy efforts, and showing the value of the program, even to yourself and your teammates as well. It's cool to see it reinforced, right? After everything that we do at Help Seeker, we send out to our customers it's called a CSAT, customer satisfaction piece, and it's like, man, I feel so good when I get a 5 out of 5. Like, it's just like that rush of like good vibes. And sometimes I get a 4, and I'm like, what? Like, how do I make that a 5? And it's anyways, it's kind of a silly example, but it does work, right? Like, we're humans. We want positive feedback, and we want to show improvement where we need it. So for us, though, in the social world, we also know that client feedback is one thing, and funder feedback is another thing. But the data tells the story ultimately, right? So if you're able to kind of see the client's progress over time, I had clients myself that would tell me to F off all the time, and be like, that's cool, but you're still housed, so that's awesome, right? Or use has gone down, or public system interactions have gone down. So that's sometimes it's the hard numbers that tell the kind of a different side of the story as well. So being able to show easily overall, how this one client's doing, but how the overall aggregate is doing as a social worker, like, that's really, really powerful. And then, of course, I mentioned the tailoring and personalization of care to get that better outcome. If you have good case management software, you should be able to track that client's goals and their progress at that individual level, and then to see which interventions happen at what point, and what happened over that client's journey. So you should be able to see, like, okay, they first came in here, they had these issues, their goals were, to get housed. I'm just making one up. Then, 3 months later, because they had been housed, something or some life event happened, now the goals changed. So you can track that progress over time as well, and be able to see patterns in that one client, but then rolling it up at the aggregate level across your caseload and then across the org or the program caseload as a whole. And then the question becomes, are there ways that you can create more personalized interventions because you're understanding the client base better, to get them to better outcomes? So if you're seeing like certain patterns in the data, and then you kind of short circuit them, is there ways that you can? Anyways, you'll know your context better than I, but that's always how we try to think about data. So as a practical example, if a client consistently misses appointments, and I think we've all been there too, the software can highlight this trend, right? Like this is that person. I know you likely know who those clients are intuitively, but I mean, social work is a profession that has grown by about 850,000 people since 2000 in the last 20 years. So we've got lots of new folk coming into the profession. I'm not talking just social workers like association of social workers. I'm talking about people on the social safety net in either health or social, but that allied health and social care. If you look at the stats in 2001, they made up about 5% of that Canadian workforce. We now make up about 7%. So, and Canada's population has grown. So we went from 1.4 million to, I think, 2.2 million people that are in this space. So that means that not everybody is as familiar as some of the I don't want to call us old timers, but people that have been at it for a long time. But things like clients consistently missing appointments, the software can highlight this trend. It can prompt that earlier intervention, and it can kind of help you dig into barriers that they might be facing, and adjusting the service just a little bit on that individual level means that they now get that care, that they get to the appointments that they need. They get the better outcomes in the long run, and fingers crossed, better experience for them, better care for them means less work for you, because you're not reacting to crisis all the time. With that particular client, you're getting them stabilized quicker. I know this is all best case scenarios as well. Like I know it takes a lot of work to get there, but the idea is, if you have the right tech, it can significantly reduce that stress. It's not going to do the work for you, but it can enable you to get to those better outcomes and enhance your efficiency. So that's the point of it. It's not to replace humans. My goodness, there's nothing in here that should threaten your sense of job security. If anything, quite the opposite. The tech is really subservient to the social worker client relationship, and I'm using the word social worker actually probably inappropriately, because there's social safety net care workers that are not necessarily designated social workers, but youth care, child care, folks that are working in the allied health space as well, justice, police, victim services, and policing is a really interesting example of that too. But the idea is, can we make the work slightly more easier, more effective, and more care focused? So another little Slido, just to make sure everybody's awake. I think this is our last one. On this one, what's one task you'd automate today if you could? You've kind of, heard from me some ideas, but what do you guys think? What's one task you'd automate if you could? And let's see what's the most annoying thing. I'm so curious. Yeah, I can tell you what I would have automated. Like for sure report writing. That's like, and I really prioritize that in my life, and I think I've personally achieved it, and I've never looked back. But Yeah, meeting notes. Yeah, there you go. Exactly. Notes, invoicing, monthly stats. Yep. Weekly stats. You'd automate self-care. I'd love to hear how that would work. Follow up with clients for service feedback. That's that's a good one. That's a really easy one to automate. Invoicing. Cool. Yes. Yes. So like automatic kind of shipping of the invoice, notes, meeting, stats. Yep. Very cool. Okay, let's give any last takers on that? No, okay. Okay. And is there one area where tech could make your work easier off the top? Legit, I think this is the last Slido. Let's see. What's one area where the tech can make your life easier, your work easier? Got a couple people typing. Let's see. And I'm gonna like also check my little chat in here to see what people say. Oh, yeah, I got some good tips. Okay. Time saving, connect globally, professional reviews, self-care. Okay, I'll give you guys a little bit more time because I see people are typing. Data dissemination and correlation. Interesting. So getting into the actual analysis of the data. Okay. Interesting. Yeah. So you've got data, but you don't know what to do with it. You've got data, but you know, what's the correlation between this type of client and this type of outcome? Yeah, absolutely. Very interesting one. Okay. AI helping with presentations. Oh my goodness. Yeah, we should do a presentation on that as well. I could show you my bag of tricks on all of this stuff. Absolutely. Yeah, there's so many tools now that where you should not be afraid to use AI. Like absolutely. Grammarly is another really great tech that makes sure that your tone is really nice as well. If you're like I said before, you can pick you can do the voice to text in your notes, and then you can put it through Grammarly just to make sure you're not making spelling mistakes, and then suddenly it looks pretty good. Okay, so, and yes, absolutely, helping you with, now on AI with presentations, cool. Make sure you're not using AI with individual client notes though, just a little privacy, the concern there, as you can imagine. Universal database for the Winnipeg Health Region, i.e. home care and long-term care. What, you don't have that? Damn it, that would, yeah, absolutely. So the ability to see the client flow between the health region and its component parts. Yeah, I'd say that's pretty important. That would make your life easier. Absolutely. And kind of essential for systems change and systems thinking. Absolutely. Okay. Uniformity in terms of universal healthcare. I'm looking at the webinar chat and this one. I'll give you 30 more seconds. And because I see one more person typing, and then we'll move into I'll do a quick demo, and then we'll see if there's any other questions before the top of the hour. Let's see. Nope, I think we're good. All right. So we'll move to the next slide here. But really the point of it is, you know, I think you all said it, whether it's working with us or working with other vendors, that there's lots of software out there. Like I'm not crazy to tell you that we're the only game in town. I can show you our software though, because we run it. But there's a couple of things that you should always be looking for, and hopefully today's session gave you a sense of what to look for and what kind of questions you want to have in place. And we're hoping that you're leaving today with some actionable insights into how the tech can help streamline your work, reduce your stress, and ultimately improve the care that you provide. So we're going to talk a little bit about Mareto. not as this is the only solution by all means. The things that I really want to highlight are those automations of repetitive admin tasks, automation of assessments, scheduling and follow-up, client journeys and progress to customize interventions, and just the ability of team members to access information and share notes in real time, but also referrals between services to ensure smooth transitions and, of course, reporting. So like I said, the whole point is, whether it's this product or something else, you know what to look for, right? When you're at the stage in your organization that you're actually looking at making a change towards that. So I'll go into here, and can I get my team to give me a thumbs up that you can see the demo screen? You see it's blurred out. That's just simply because of a security. So it just makes us have to log in again, which is good. That's another tip for you. You want to be able to do that. And as you can see here, I'm just looking at a very high level in terms of all the organizations that I have in here, but obviously I'm not going to be able to show you all of them. I'm going to show you something that we very much made up, just not made up, but made it as something to show without revealing any real client information. So just off the top, everything you're seeing is one thing too, I should also say is, don't let vendors tell you that how to do your work. The vendor should actually be, talking to you about how their tech can help you, not the other way around. So you shouldn't be pretzeling yourself into the software. The software should match where you're at. So the idea is, that it should be custom to you. And so while one organization might want something like, oh, we want the first page to be announcements, cool, and we want the ability to create new bulletins every day. So that ability is really, really important to enable you to do that. I'll show you a couple of things as well that have been really emblematic of what we talked about today. This one is very simply a form. And so forms are things, and again, this is a made up one, but you can imagine your logo in here. You can see it's online. So one thing that we've seen organizations like is actually being able for their clients and their staff to fill in the form directly online and really go through that consent process and do the service in particular ways through an online platform. So one thing for sure is, this ability to also customize things like gender, right? And how people self-identify. And again, we've got like gender 1, 2, 3, 4, new gender. It's the ability of the software itself to keep up is huge. And you should not have to do again, pretzeling and having to contact a developer. This was actually done by a social worker, actually a teacher, not by a developer. So the software should be as easy as you making the form yourself, right? And so being able to change the form on the fly and being able to do that without having a ton of, any development needs. So this is one piece. The other one is that, automatically populating your database. So having that intake table and seeing exactly who's coming in and when, and if there's, of course, the need to group them. Let's say you want to be able to group them by, I don't know, somebody says to you, group them by risk factors, let's say. Okay, these guys are uncategorized, but we can see we've got 0 for diagnosed mental health. We've got 1 for a couple of things happening. We've got 0, 0, 0. But again, the ability, see how I just grouped? I can also do none. I can also group them by gender. So if somebody's like, how many women do we have in the program today? 6. Okay. How many do we have by city? Okay, well, we got 6 from Airdrie, we got 8 from Calgary. It's like it shouldn't be this giant process, is my point. Somebody says, can you sort them all by, I don't know, by province? Okay, sure, right? So just that ability for you guys to control your data and to be able to massage it in real time. It's just like, you shouldn't settle for anything less than that. So then you can do things like this as well. And it's so simple. So you're adding a new client, they automatically show up in the data. You can play with the data, on a dime, and you can start to look at things like creating nice reports, right? So you can say, for instance, I want to create out of this intake table, I want to see, how many registrations I have over time. That's just something that we all want to see. I also want to see where they're coming from. Again, how many do we have from Calgary, from Edmonton, Okotoks, Red Deer? I want to see registrations by gender. Cool. Okay, now I want another one. I want, let's say, let's go by province. Okay, and I want it as a table or a column, right? Or I want it as a pie chart. Oh, okay, apparently we just have like lots of Alberta, which is cool. And oh crap, this isn't the right color. I want it to be pink because my funder really loves pink. So there's so much of that. And like you can see, I just made that up, right? And I'll erase it because who cares? But that whole idea of being able to really see things the way you want to see them in a way that makes sense is huge. Okay, so the other piece that I said we wanted to really show y'all is the ability for automation. So when a date arrives, send a notification. Okay, when a date arrives that a report is due, send a notification to, right? So a session start time, case notes, dates of submission. Send a note to everybody on this task, all members, that please review, right? And now you save the automation, and now everybody in this team is getting this automation. Okay, sorry, whoever is I just made that up for, and so again, this type of automation can happen in so many ways. So we can automate reminders. Okay, and we can send reminders. We can automate updating an item when a checkbox is, imagine a client says yes to treatment. Holy crap. Okay, they check that box. If checkbox is checked, change label and move item to folder. Client accepted recovery service. Now they're moving into the recovery bucket, and now it creates a whole series of new things that needs to happen. So all of these, when I said make a task list and figure out what you want to automate, it's so easy now to automate those things that are recurring. Every Wednesday we have to send this report. Well, boom, you can literally, when we've done these before, send the data, right? So not download, but okay, or export to CSV and send to boss. Cool. The other thing I'll show you as well, and again, Sally Turner's case notes. This is something that you guys might see if this is your actual Sally case notes. Your ability to see kind of where Sally's at and what has happened, and again, taking those case notes. And you see Sally is open to me as the caseworker, but Bob is not, right? So Bob is not my client. Bob Turner's not my client, but Sally is. My boss can see things at their level, and we can see things at our level. So that ability to customize views is another huge component as well. And again, this is stuff that's highly auditable too, right? Because we've got that ability to track interactions. And if somebody says, are you sure you did something? Are you sure you did something for Sally? Because like, not that I don't believe you, but and we can actually see that, Travis was assigned to it, and we can create case notes. We can tag each other in them. So creating some of these comments, this is the one I'll show you, and then we'll leave to you. But you can say, Sally needs your help now, and tag, right? Tag Travis. Activity log, we can see when that Travis didn't look at it for a month, right? Like it keeps you guys honest with each other and the teammates as well. So, so just wanted to share a little bit about what this stuff can look like in terms of an actual software. And of course, if you wanted to go deeper, I would be remiss to not give you a sense of how to get in touch with us, but by all means do so. And here's our contact info at helpseeker.org if this is of interest. Would love to dig in deeper with you. Either way, hopefully this was useful to you and give you some ideas on how tech can be your new best friend, hopefully. So thank you guys so much. For sure, we'll wrap this up and send you the recordings. Thanks, y'all. Bye, everybody.